This educational clinical video presentation is brought to you by the Department of Obstetrics and Gynecology of the Chinese General Hospital and Medical Center. Today we will be discussing prenatal care. Since we are currently in the COVID-19 pandemic, we would like to advise proper hand washing, proper wearing of face mask and face shield when going outside, and social distancing in order to reduce the transmission of the virus to the pregnant patients. First prenatal care visit should ideally be done during the first 10 weeks of pregnancy so that the first trimester ultrasound could be done. How often should prenatal visits be done? Ideally, during the first 28 weeks of pregnancy, visits should be done every 4 weeks or at least every month. During the 28th to 36th week of pregnancy, visits should be done every 2 weeks. More than 36th week of pregnancy, the visit should be every week. The first routine ultrasound should be done before the 20th week of pregnancy because it is a better estimation of gestational age. The following patients would need more frequent prenatal visits. A pregnant patient would need daily supplementation of vitamins and mineral for her and her baby. The following are needed during pregnancy. Should a pregnant patient be vaccinated against COVID-19? The answer is a big yes. Pregnant patients have a higher risk of severe illness from COVID-19 than non-pregnant patients. The vaccines are very effective at preventing COVID-19 infection, severe illness, and death. Recommendations, methods of breastfeeding, and frequency and length of feeding. WHO and UNICEF recommend that children initiate breastfeeding within the first hour of birth, and be exclusively breastfed for the first 6 months of life. Infants should be breastfed on demand, that is as often as the child wants, day and night. There are many mandates regarding breastfeeding in our country. RA 10028, or the Expanded Breastfeeding Promotion Act. Support for breastfeeding mothers in the workplace means that a workplace needs to have a lactation stations and lactation periods for breastfeeding mothers. Other mandates include the following. The next following slides would discuss on the benefits of breastfeeding to the mothers, infants and the community. Benefits to the mother. Benefits to the baby or infant. Benefits for the community. Breastfeeding is important because the baby gets more immune-rich colostrum and therefore more protection from illnesses, and faster weight gain of the baby. The methods of breastfeeding are the following. Latch on, cradle hold, football hold, side lying hold, and laid back breastfeeding. During latch on, a baby's mouth forms a tight seal around the nipple and most of the areola. The baby has a good latch if the top and bottom lips are wide open. The lower lip is turned outward against the breast. The chin is touching the breast, and the nose is close to the breast. You and your baby are completely comfortable during breastfeeding. During cradle hold, the infant's head and body are supported by the mother's left forearm. The baby's stomach should be flat against the mother's chest, and the baby's head should be in line with the body. The mother's free hand supports and guides the breast to the infant's wide open mouth. The football position allows a woman to easily see the baby at her breast. The baby is supported by a pillow as the mother sits, which should allow the baby's head to be at the level of the mother's breast. The mother's free hand supports and guides the breast to the infant's wide open mouth. The side lying position allows the mother to nurse while lying down. To nurse from the left breast, the woman lies on her left side. The baby's head and body lie parallel to the woman's body, with the baby's mouth close to and facing the woman's left breast. The laid back position facilitates the natural breastfeeding behaviors with the full body skin to skin contact between the mother and baby. Fresh breast milk at room temperature can last for 6 hours. If breast milk is kept in the freezer, it can last up to 6 months. For more information about our services, visit the CGHMC website at cghmc.com.ph. Thank you.